My name is Helen Oxenham. I'm one of the cardiology consultants that I work in England.
My name is Joel Dunning. I'm a consultant cardiothoracic surgeon from Middlesbrough in the United Kingdom.
My name is Dr. Gordon Ofelabi, and I'm a consultant cardiothoracic surgeon and currently the head of Department of Cardiothoracic Surgery.
My name is Professor Andrew Owens. I'm a consultant cardiac surgeon.
In James Cook University Hospital in Britain, we love performing a wide range of heart and lung surgeries. We do everything from complex aortic surgery, mitral surgery to revascularization. We love doing it every day because we love saving the lives of our patients and returning them to the community in a healthy way.
I've got to say that Ugmc have got fantastic facilities. I was really impressed the first time I came here. Some of the equipment you have is better than some of the equipment I have at home. It's newer. So I think you've got a fantastic facility, and that means you've got huge potential for the future.
We came here and did the very first heart operation with the surgeons here, and from that day till now, when they're doing regular surgery every single week, we're so pleased to see them growing as a team and getting better as a team. They've come to visit us in the UK, and we're going to continue to visit them in Ghana.
We've been doing complex procedures, and they include surgeries on a beating heart. We did off-pump coronary artery bypass graft for persons with blocked coronary arteries, and they were done on a beating heart. And these were done with using modern technology.
So we're very happy on this mission. We're performing more operations than we've ever performed in a week. And that's a tribute to the local team because they're so much better organized. We're doing really well. They're doing everything exactly like they've seen in the United Kingdom. So by the end of this mission, it's our last day today, we hope to have done 9 surgeries, which is roughly double what we did on our first trip here.
It is exciting surgery. It takes a very long time sometimes, and it's quite high risk surgery, but it's very rewarding. I just met one of the patients that we operated on when we were here 2 years ago, and it was just so good to see him. He's back at work, he's doing really well, so it's really very satisfying.
So when you undergo major heart surgery, that is a huge undertaking, but it is life-saving. So you usually spend 1 or 2 weeks in the hospital here at Ugmc, but it will take you maybe 3 months to get back to your work. For example, the patient Ben we saw from 2 years ago, he said that after 3 months he was fully able to go back to work and then work a normal life.
The key thing is that doing the operation is one thing, but afterwards we need to make sure they're started on the right tablets to support the heart. So if the heart is weak, they need to be on the heart failure tablets, and we've got to make sure if they've had a mechanical valve that they're on blood thinners and that there's a plan for how to monitor the blood thinners, and we need to make sure that the heart rhythm is correct. So we've been, with the team in Ghana, we've been doing ward rounds every day to look after these patients who've had the operation so that we can together get the right care for them.
Currently in Ghana, the minimum for open heart surgery is around $8,000. And our patients are paying just a token. And some others who cannot pay anything at all are offered the procedure for free. They donated quite a lot of consumables, from bypass circuit, from heart valves, the current heart valves available on the market, and many other devices, which I cannot mention. There are quite a lot.
Well, maybe we brought $30,000 worth of equipment to come over and help with heart surgeries. We think it's really, really important to support the program as much as possible. Some people can afford surgery, but for some who find it difficult, we want to support as much as possible so that everybody can have a chance to have life-saving surgery if they need it.
It will go a long way to, one, reduce the costs of heart surgeries, and so patients will now have to pay a subsidized amount with these interventions from the visiting team.
But because you're getting more cardiologists here and they are very aware of what we do, I think we can rely on them to follow up the patients. Again, the patient I saw this morning, he's got his own blood pressure monitor, and he showed me the app on his phone with all of his blood pressure monitoring, so he's doing a really good job looking after himself.
We've been working with the UK team and Arrhythmia Alliance since 2022, March 2022. And so it's been over 3.5 plus years.
We're hoping to do the first endoscopic lung surgery that has ever been done in this hospital. So we're trying to bring lots of new procedures, and as well as cardiac surgery, we're going to start to bring more advanced lung procedures to this hospital. And we've already done one this week, and we hope to do 2 more today.
So it depends a little bit on the nature of the surgery. But the patient we did yesterday, it was, how long? It must have been a 6 or 7 hour operation, I think. And he was kept asleep overnight and he was awake, and I was talking to him this morning. I would expect him to go home within a week. I would expect him to be able to go to work maybe in 8 weeks' time. So because we divide the breastbone, it takes a few weeks for that bone to get solid, and that is the thing that slows you down the most. But most of the patients here are young and fit, so I expect them to make a prompt recovery in a few weeks.
The future looks bright. With these collaborations, we are picking up new skills, and we'll continue because it's a continuum. And so hopefully in the not too distant future, we should be able to perform many more complex procedures without the visiting team. So it's been really beneficial having the visiting team around.
So for the team here, just building up combined experience with us, and we're getting experience from them, is the way forward. And as they do more and more work, they will do more and more independently and get better and better results.
It's a two-way thing really, is that some of the patients that we see have got pathology that's extremely rare in the UK. So I've just scanned a young man with aortic coarctation, and that would be more unusual in the UK, or if I saw them, they'd already would have had the scan and things. So it's really nice for me to be able to do those scans on people with pathologies I wouldn't usually see. So
I would love to say to the public, if you think you have a problem with your heart, do go and see a doctor and see a cardiologist. Maybe if you have somebody in your family that doesn't feel well and you're worried that it's their heart, do go and seek help. You can feel your pulse. If you feel your pulse just on your wrist or your neck or one of your family members, the heart rate should be between 60 and 100. If it's very fast or very slow, go and see a doctor. Or if they feel unwell, see a doctor.
Just to remember, particularly as a woman, cardiovascular disease is the biggest killer for women worldwide. It's not breast cancer. And sometimes I think women particularly forget that. So it's important that we know about these numbers that people talk about. So we need to know what our cholesterol is and our blood pressure is. And if they're abnormal, to think about how to improve them, so that we can, as a population, both in Ghana and in the UK, improve our heart health.
We should take our heart health seriously. We should do routine medical checks. It is not a luxury, because the price you pay for not doing regular medical checks are quite, huge. And so people should take their routine medical checks seriously, and it should be routine and should be done on a regular basis.
The team here are incredibly dedicated. The surgeons are good. The other staff, the nursing staff, the associated staff have made fantastic progress. Some of them spent some time with us in England last year, and that's had a benefit as well. Intensive care staff are incredible now. So I think there's been huge progress made. And I think the key is for the community and the government to continue to support this unit with funding, with resources, and then you can offer an even better service for the people of Ghana.
Yeah, and I just wanted to say that it's a great joy to be in Ghana. The team are so hardworking, and they're passionate about getting the best for their patients, and it's really inspiring to work with the people here. So thank you very much for letting us come and work with you.